There is no debate at this point that face masks and social distancing work in slowing or halting the spread of coronavirus. We have seen this done successfully in other countries, and we can do it here too. So it absolutely works. The key with universal masking is the word universal. Everyone has to do it. And I think that's really the point I want to drive home to the viewer. If you're wearing a face mask, you're protecting the person you're talking to. But if they're not wearing one, then they are exposing you to the virus in case they're an asymptomatic carrier or they haven't developed symptoms yet. And so we really need to encourage everyone in the community to wear a face mask and remind them why they're wearing it, and that this will work for us in South Carolina if everyone participates. So there's a lot of misinformation out there, unfortunately, that is causing people to be skeptical of wearing masks or fearful of something bad happening if they wear a mask. And there is no evidence that wearing a simple cloth face mask to contain your own respiratory droplets is going to harm your health in any way. Okay? As long as you're following the CDC guidelines with how to wear it, make sure it's at least a double layer of cloth and it fits snugly yet comfortably on your face, it is safe for you to wear. And you just want to follow the CDC guidelines with washing it regularly. At this point, it'd be good to just have multiple face masks so that you always have a clean one that's handy. But it is safe for you to wear a face mask. Now, if you have respiratory conditions or some chronic lung conditions or something like that, speak with your doctor first. But for the majority of the population, it's perfectly safe and definitely effective in slowing the spread of coronavirus. Just think about all the people who wear face masks every day, have been wearing them for their jobs. Doctors, nurses, and people in the medical profession wear masks every day for hours at a time to do their job, and they're okay. So I really encourage people to just use some common sense here, think about it that way. So I think there's some misunderstanding about why people are wearing a face mask. You are not wearing a cloth face mask or even a blue surgical face mask so that you don't breathe in infection. You're wearing it to contain your own respiratory droplets in case you have the coronavirus. The power there in decreasing the spread of coronavirus is if everyone wears one, if everyone's containing their own respiratory droplets, then we're all protecting each other. So it doesn't work if everyone's not participating. So to explain a little bit about the different face masks that you see people wearing. So typically people are wearing either a blue surgical face mask that they got at the doctor's office or for some other similar clinical setting, or you're seeing them wearing a cloth face mask. And of course, you can get these very easily now, either online or you can even make your own. The CDC has guidelines on how your masks should fit, ideally. Now, wearing something is better than nothing, because yes, containing your respiratory droplets, that is the key to us slowing the spread of coronavirus. The way to wear a face mask effectively is to make sure that it fits snugly but comfortably against your face, so it's not gaping on the sides or the bottom. You want to make sure it covers your nose and your mouth. If your nose is sticking out, it's not doing what it's supposed to, okay? Remember, you're wearing a cloth face mask or a surgical mask to contain your own respiratory droplets. There's a lot of misinformation out there and things out there that are trying to scare people away from doing something that is simple and safe in halting the spread of coronavirus, and that is wearing a face mask. So reassurance, it is safe for you to wear a cloth face mask that fits you appropriately.